Have you or someone you know has suffered from stroke recently? Is the person who is suffering from stroke is struggling with speaking? Maybe the words feel slurred or one side of the face is not moving well. Facial palsy resulting from stroke can significantly impact the speech at the same time communication abilities. This happens due to an abnormal muscle tone that is developed around the facial region, your tongue muscles, and the coordination that is impacted in your breathing, your facial movements, and your tongue movements. When your muscles of mastication, at the same time, the muscles of facial expressions are affected, it will cause difficulty and challenges in communication. This is a particular challenge for people who suffer from stroke that's related to damage that happens to the brain region that controls your facial movements and area of communication. In this video, we are going to understand how your facial paralysis due to stroke impact your speech and how you can overcome it. Let's get started. Stroke leads to facial paralysis in lower fourth of the face. This impacts your face in multiple ways. Number one here is impaired articulation. When your muscles are spastic and weak, it becomes harder for your muscles to pronounce certain words which involves the combination of your tongue and your lip movements, which makes sound heard very unclear and will also affect the pronunciation. For example, words like p, b, m, f, v, all of these words where your tongue and the lips have to touch each other will be affected, changing the pronunciation patterns. When there will be lip closure challenge due to spasticity of the lip muscle, that's where the communication also get affected. Stroke can cause difficulty with lip closure, which will impact the ability to produce sounds like ma, pa, ba, fa. In all of this, as you saw, the lip closure is very important in the production of the sound. This gets affected due to the spasticity of the lip muscle, resulting in slurred speech. The third challenge here is reduced expression. When your facial muscles are tensed and tight, at the same time weak, the ability for these facial muscles to move in coordination with other facial muscles gets impacted, which changes the way a person communicates through their expressions. Throughout the day, we make micro expressions that are mirror of our thoughts, our state of mind. When stroke happens, one side of the face is paralyzed, which reduces the speaker's ability to use facial expressions to empathize their words and convey their emotions. This will make persons seem less expressive and will impact how the speech will be interpreted. The fourth challenge is drooping and asymmetry of the face. Whenever a patient or a person suffers from stroke-related facial paralysis, the lower half of the face is paralyzed. That's where there is an asymmetry that develops not only during the resting phase but at the communication phase as well. The normal side of the face starts overcompensating for the actions that the affected side of the face is supposed to make. Facial drooping and asymmetry not only causes this asymmetrical facial tone but at the same time impact voice tone and can affect both clarity and sound quality. The fifth problem here is increased fatigue level of the muscles. The muscles will get tired very easily. A person might experience fatigue from trying to compensate for weakness, especially when it comes to speaking for extended period of time. So since all of these challenges are critical and can impact a person's ability to communicate, thus impacting the quality of life and self-confidence and self-esteem, it's very important that right rehabilitation protocols and techniques has to be applied to help these patients overcome these challenges. So what are the right techniques and methods that can be used to help people with speech-related issues when it comes to stroke-related facial paralysis? We can divide it in three forms. Number one is the speech therapy part. Speech therapy is very critical. Speech therapy is very critical when it comes to helping patients with stroke overcome their communication challenges. Speech therapy incorporates personalized strategies that helps a person to improve their articulation, breathing support, and lip control. Next is facial re-education, which majorly focuses on retraining the facial muscles to move and function the way they used to function before. This incorporates practices like facial massages, facial stretches, and facial exercises to maintain the facial muscle property at the same time retrain these facial muscles. And the third thing that is done sometimes is Botox therapy. This is majorly to work on the spastic muscle or overactive muscles by inhibiting them. When Botox is applied, it inhibits these overactive muscles and help to retain the muscle tone, helps to gain symmetry of the facial muscles, at the same time eases out the entire rehabilitation process. We at HealthQ Rehab offer a oromotor rehabilitation protocol or program that combines a combination of speech therapy and physiotherapy together to help people suffering from stroke overcome their communication related challenges. The benefit is they get advantage of two therapies which are very important, the speech and physio for face both together at the same time. This improves the recovery timeline and at the same time helps an overall recovery for an individual. Hence, it's ideal to see a therapist and get a personalized program. If you want help from us, you can reach out to us so that we can understand your problem and can help you in a better way to overcome your communication related challenges. But that's not all in this video. I have some important tips for you that you can practice at your home to improve your. Let's see what are these tips. Number one, do regular daily facial exercises. These facial exercises doesn't have to be intense but should be mindfully done in relation to the expressions that you make on a day-to-day basis. These exercises could be in the form of simple expressions like smiling, pucker, disgust expression, sad face, etc. The more you practice these expressions, more your brain cells will recall them, they will rewire and will help you to learn these movements and regain these movements. Regular facial exercises will also help to reduce these muscle tone, at the same time regain these facial muscle property. It will prevent the facial muscles from getting atrophied, which is very big challenge in the later stages of stroke. So make sure to do regular facial exercises. Second practice is repetition of sounds. Practice making sounds like ba, ka, da, etc. When you practice making these sounds, you again retrain your brain. You use your memory to work on retraining your voice production. Practice 2 times in a day for 5 repetitions is more than enough for helping you to retain and regain your voice. Third most important thing is breathing exercises. Breathing muscles are very important when it comes to voice production. So simple breathing exercises like single nostril breathing, deep breathing, diaphragmatic breathing, etc. can be incorporated into your day-to-day routine in order to get better outcomes from your recovery. Fourth practice is mouth and tongue stretches. Stretching of the muscles around the mouth and tongue stretching is very important to gain a proper flexibility of these muscles. We have already made a video on how to do tongue stretches. You can check this video out. We will place them in the cards so that you can learn the practice by yourself. The fifth practice is facial sensory stimulation. Using different textures, you can stimulate your facial muscles by just gentle stroking. What it does, it actually sends good feedback, good signals, sensory signals to your brain, raising more awareness on the one side of the face which is affected and helping the brain to develop more awareness on that side and regaining the facial movements. Seventh is mirror practice. Spending some time in front of mirror, especially looking the lower half of the face and just comparing the good side versus the non-affected side and just trying to match the movements will also help your brain to retrain well. And last but not the least, a positive mindset is very important in this entire process. Recovery from stroke is a time-consuming process. It requires a lot of stamina, willpower, and positive attitude. With simple practices like journaling, goal setting, and communicating your goals with your therapist help you to stay motivated and stay consistent with your practices. Remember, consistency is the key when it comes to recovery and rehabilitation from any kind of stroke-related impairments. So be consistent, stay positive, and work towards your recovery. On that note, I'll end this video here and I'll see you in another video. Thank you.